American medicine is the finest in the world. People come from other countries to experience the best American medical technology has to offer. But millions of our own citizens can't afford even the most basic care. And many others helplessly surrender their economic security to get the care they need. Hello, I'm Jim Hartz. Americans pay more for health care than any country on earth. In 1992, we will spend an estimated $800 billion. That's 14% of our gross national product. By 1995, it's expected to rise to $1 trillion. And unless we seize control of costs, health care spending will soar to $1.9 trillion by the year 2000. The American Association of Retired Persons believes that our American health care system must be reformed. But the longer we wait, the more expensive it will become, both in economic terms and in human terms.
For more than 20 years, Susan Hill has met the health and long-term care needs of hundreds of patients. The 50-year-old licensed practical nurse works in a Toledo nursing home.
You're fine. You're safe. You're okay.
She has seen firsthand the devastating effect rising health and long-term care costs have on people.
I think it's really sad that people have to reach the level of poverty and to just dissolve all their assets that they worked for a lifetime to qualify for any medical help.
But when her shift ended, she could escape that harsh reality and find comfort at home. Susan and Robert Hill were like any responsible, hard-working family. Robert drove a truck and enjoyed a good salary and excellent benefits with the Teamsters. Susan worked at a Toledo hospital and was planning to return to college. Together, they raised 2 sons and dreamed of a secure future.
We were going to have a good life, and then boom, it all caved in.
When Robert was 54, he was diagnosed with Alzheimer's disease.
Keep your finger over that hole.
I was just devastated because I knew what the outcome would be. It's a progressive disease. He's just not going to get better.
Robert immediately lost his job, and with it, their main source of income. Because he needed care, Susan took a part-time job at the nursing home. They waited 6 months to get their pension and Social Security disability checks. Meanwhile, they sold their home, moved into a small 2-bedroom house, and withdrew their savings.
Well, his medication right now, I paid over $3,000 last year. That's all out of the pocket. I'm not able to get him any Medigap insurance because he's too young. You have to be 65.
4 years have passed since Robert was diagnosed. His years on the road, even his 25th wedding anniversary, are fading memories. At night, he wanders aimlessly. And because he could harm himself, Robert now needs constant supervision. Medicare does not cover the long-term care services that he needs. And because the Hills can't afford it on their own, Susan resigned from her job at the nursing home to become his full-time caregiver.
He's sick and he's dying. And I gotta worry about finding money for his medicines and giving him decent meals. It just doesn't seem in balance. It's not right. That's the way it is now. There are people like myself who are kind of, we fall between the cracks and we need help. I mean, we're human beings. We want to be treated with dignity and respect. No pity. Don't turn your back on us. We're here. But life happens. It just comes along and hits you right in the face. And you just feel helpless at times.
Pan Am Airlines was one of the world's great carriers. It was an American success story, thanks to dedicated, long-time employees. After investing 25.5 years with the airlines, John Sable, a 54-year-old radar specialist, assumed he was as secure as the planes he serviced. Just before Thanksgiving, Sable was diagnosed with rectal colon cancer. when he most needed the insurance that he helped pay for, it wasn't there.
So Monday, December 2nd, checking with the boss to see what I had, in way of financial coverage. I went into the hospital on Monday afternoon. They done the surgery on Tuesday, and coming out of intensive care unit, being wheeled to a room, I saw on a patient's TV where Pan Am had went belly up.
Pan American World Airways has stopped flying.
I haven't got any sick pay. I lost my vacation pay, nothing. And I'm not even eligible for unemployment checks. I called them up when I was able to, when I got out of the hospital, and they says, well, I'm not ready, willing, and able for work. I'm under a doctor's care, so there's no unemployment checks either. We're living on my wife's salary and savings until that's gone.
John Sable is not alone. When Pan Am shut down, some 10,000 workers were robbed of their livelihoods and their futures. Nilda Nyborg was with the company for 12 years. In September, she underwent surgery and was told the bills were paid. Today, she is left with thousands of dollars of unpaid medical bills, no job, and no coverage.
I'm a single parent with 2 kids, so if they get sick, I'm in trouble.
There's a lot of people out there in this situation. Way too many.
Mike Ozegovich sees hundreds of former Pan Am employees every week. Once the president of their local union, Ozegovich now works as a counselor for the Dislocated Workers Assistance Center in Miami.
There is no coverage, where these people can go to without paying a lot of money. And of course, since they're unemployed, they don't have a lot of money, so therefore they just don't have the coverage. Now the question is well, if they get ill, will somebody pick them up off the street and bring them to a hospital, and will the hospital take them if they don't have the coverage?
Ozegovich understands the pain and fear of the uninsured. He invested 30 years with Pan Am. His current job is temporary, and it does not provide benefits.
There's no question I cannot get sick. There is no question I can't get sick. I can't afford to get sick. If any kind of a catastrophe happens, that's it. Everything is gone. 30, 40 years of work goes out the window.
They have to come up with something a little better to help us. Because if not, I don't know where we're going to be at. We're going to find a lot of people dying for minor things or because there isn't any health care that we can get.
Nilda is young and healthy. But what about John Sable? A 54-year-old cancer victim is trapped.
Whose door am I going to go knocking on looking for a job? And what agent am I going to go ask at any premium for health insurance? It's like going down a river, torrent. You're going down and that's it. You just watch everything eventually disappear and sink to nothing.
The retirement years have not been healthy years for Rudolph and Carrie Green of Biscoe, North Carolina. After a long career in the traditionally low-paying textile industry, Rudolph receives a small monthly pension, so the majority of their $1,300 a month income is from Social Security. The Greens have an unending list of age-related medical problems in addition to diabetes.
I have type 2, and that's the worst diabetes you can have.
Rudolph, 77, and Carrie, 74, have been in and out of the hospital in recent years, and they have seen their out-of-pocket expenses increase dramatically. Their biggest out-of-pocket expense is prescription drugs. In 1991, they spent more than $3,400 at the pharmacy. This year, Rudolph knows the bill will be even higher because between them they are on 11 different drugs.
That's one of my main heart medicines. That cost us $50. I just had it refilled the other day, and that's what I get for $50.
So while they struggle with the bills and their physical conditions deteriorate, the Greens face a future clouded by uncertainty.
At her age and as bad a diabetes she's got, and she's got a weak heart, and it may come to the point where she'll need care, and I won't be able to do it. But in a case like that, that's where, again, we would need, if there's just some kind of a plan that would help us if something like that happened. And where is it? Where is it?
After watching these real-life stories, you might be tempted to say it could never happen to me. But in the blink of an eye, you can go from the picture of good health to a chronic, long-term illness. The truth is, you, me, every one of us is vulnerable to our failing healthcare system. The American Association of Retired Persons believes the time has come for action. The need for comprehensive reform overrides what some may view as our own self-interest. Although AARP derives considerable revenue from the health insurance policies we make available to members, we will gladly forego every penny of it in exchange for a better and more affordable health care system, a system that offers health and long-term care services through the continuum of life from birth to death. And so, AARP set out in 1990 to go beyond the problem to the solution. In January, the National Legislative Council, AARP's 38-member all-volunteer legislative policymaking body, gathered in Washington for 6 exhaustive days of review and debate. The NLC adopted a resolution on health care reform and agreed that any solution must attain 4 basic goals: provide universal coverage, control costs, ensure quality, and cover long-term care. The association's volunteer leadership conducted more than 25 field hearings in which members and the general public heard testimony from experts and shared their concerns with us. When you spoke, we listened.
We're not looking for something just for AARP members. We're looking for something that's going to benefit all of the population of the United States.
AARP also held health care reform forums across America. Here, we shared the information we gathered from experts and engaged you in discussions on the solutions.
If we're going to get some service, we have to pay for it.
Meanwhile, AARP conducted polls and surveys to determine where the American public stands on health care reform. And we read thousands of letters sent in to us by concerned members like Rudolph Green and Susan Hill. From Maine to Maui, you told us the same thing. We want a better health insurance system. And so, as your representative, the National Legislative Council began serious deliberation over what kind of system we needed. The Council examined many approaches to reforming the nation's health care system. Because no one plan met all the AARP's principles of reform, we took the best elements of these approaches along with our best ideas and blended them into a uniquely American plan, one that we call Health Care America. Here it is, AARP's draft proposal for health care reform. This is a draft, a blueprint for a highly efficient and fair health care system. In this program, we will share this draft with you for your review and consideration. This plan will remain a draft until early 1993, after we've had time to hear from you. Let's begin with an overview. Health Care America would guarantee that all individuals, regardless of age, income, employment status, or health, would have access to a range of comprehensive preventive, health, and long-term care benefits. Under AARP's proposal, Medicare, one of our country's most effective programs, would be strengthened and improved to cover everyone. Employers could enroll their employees and their dependents in the new Medicare program, or they could provide private coverage. However, that private coverage would have to be as good as or better than the Medicare coverage. Adults enrolled in the new Medicare program would pay a monthly premium for doctor and hospital care. For individuals, the premium would be $50 a month. Couples with kids would pay $125, regardless of the size of their family. Adults receiving insurance from their employer would pay no more than 20% of their plan's premium. One of the draft proposal's major features is the MediCard, a single health insurance access card. With this card, everyone would have access to the following comprehensive benefits: preventive screening services such as mammograms, cancer screenings, dental, vision, and hearing screenings; inpatient hospital services, including surgical services; hospice services, and inpatient mental health services. For this next set of benefits, you would pay a 10% co-insurance. Outpatient prescription drugs, outpatient and surgical outpatient services, physician services, home health services such as home nursing care, skilled nursing facility care, X-ray and lab services, outpatient mental health services, and dental, hearing, and vision treatment for all children and for adults with lower incomes. The deductible for these services would be $200 for an individual and $400 for a family. And even though you would pay a 10% co-insurance for some services, your annual out-of-pocket medical expenses would be limited to $1,500 for individuals and $3,000 for families. This is the very most you would pay for medical and hospital care, no matter how sick you were or how long you were in the hospital. The new Medicare program would offer a comprehensive set of long-term care services. The benefits would include assistance with daily activities in the home and community. People needing care would get someone to help with such activities as eating, bathing, dressing, and meal preparation. You would be responsible for 20% of the cost of home and community-based services. Individuals would not pay more than $1,500 a year or $3,000 a year for a family. People with lower incomes would pay less. Today, nursing homes cost an average of $30,000 a year. Under Healthcare America, you wouldn't have to go broke and you wouldn't need to first pay a deductible. Out-of-pocket payments for room and board would be subjected to monthly limits based on income. For example, a person in a nursing home with an annual income of $15,000 would pay only $200 a month. If you had an annual income of $25,000, you would pay $625 a month. Healthcare America achieves AARP's 4 basic goals for reform. Everyone, regardless of age, income, employment status, or health status, would be eligible for the full range of coverage. The plan would control costs by establishing health care spending targets. These budget targets would enable us to control the rate of spending and gradually bring it down to a rate closer to the growth of the economy. The plan would control fees charged by doctors and hospitals. It would reform medical malpractice insurance to address the concern that physicians may be performing unnecessary procedures to protect themselves against malpractice suits. And it would strictly limit prescription drug prices. The plan would strengthen vital health research and quality assurance programs by encouraging continued improvement in our technology and in the quality of our health services. It would also preserve your freedom of choice. And Healthcare America, unlike other plans, would provide comprehensive long-term care services. Families would be protected from impoverishment because long-term care costs would be affordable for everyone, regardless of income. Healthcare America would also encourage us to become a healthier nation by placing new emphasis on preventive care. By diagnosing and treating problems early, we may prevent costly illnesses and reduce the use of hospitals. The MediCard streamlines administration, cuts down on costly paperwork, and best of all, it's easy to use. Here's how. When you visit your doctor, you present your card. A computer electronically bills the new Medicare program or your private insurer. Your doctor receives full payment from either Medicare or the private insurer. In turn, Medicare or the private insurer bills you every month for any deductibles or co-insurance. If you need long-term care, your card enables you to contact a specially trained nurse or social worker who would help you get the care you need. This little card would eliminate much of the nightmarish complexity of today's healthcare system, and it would also help to reduce administrative costs. But let's be honest, the savings would not be enough to pay for Healthcare America or any other comprehensive healthcare reform plan. AARP estimates that it will take an additional $112 billion in new taxes. Here's why. Currently, a large amount of health care is paid through taxes. The remainder through employers' taxes and premiums, and individuals through premiums and out-of-pocket expenses. Under Healthcare America, even though you would continue to pay premiums and a portion of the cost of services, your out-of-pocket costs would be substantially reduced. Many employers would also pay less. But to make up for your savings, we would have to increase taxes. So, who pays for it?
I think that everybody understands that health care is enormously expensive, that it's an enormous subject, that there is no free lunch, that it's much too big a problem for just one group or another group to pay for, that we're all going to have to share.
Revenues for Healthcare America would come from 5 primary sources: existing federal health care revenues, state monies that are currently paying for programs like Medicaid, an 8% employer payroll tax for employers who choose the new Medicare program, premiums for enrollees in the new Medicare program, and yes, new federal taxes. Since increasing taxes is the fairest way to spread the cost to everyone, AARP submits 2 options for coming up with most of the new money. One way is through a special 3% national income tax, which would apply to all income above $15,000 per person or $20,000 per couple. For instance, for a couple whose combined income, including Social Security and tax-exempt income, is $30,000, the tax would be $300. The second option is through a 5% tax on consumption called a value-added tax. A VAT tax, which is similar to a sales tax, would be figured into the price of all goods and services, except on food, housing, and medical care. The tax would be refunded for those with low incomes. While the new income tax or the VAT tax would pay for most of Healthcare America, some additional money would be needed. The balance of the funding would come from the following: increased taxes on alcohol and tobacco. These would be doubled to reflect the health costs associated with their use. A 5% surtax on existing corporate income tax. This would offset the plan's substantial savings to many employers in employee health care costs. To help finance the long-term care protection, an estate tax would be imposed only on very large estates over $2.5 million. All of these funds would be deposited in a trust fund to be used only for health care. Healthcare America would require some trade-offs. For instance, the $50 monthly premium is $13 higher than the projected Medicare premium for 1993. And the planned deductible of $200 is higher than Medicare's current $100 deductible for doctor services. But here's the good news. The deductible is about $500 less than the hospital deductible will be next year. So if you're hospitalized and need a doctor's services, you would pay $200 instead of the $800 you'd be paying under the current Medicare policy. Healthcare America would reduce your out-of-pocket spending by eliminating payment for inpatient hospital care, hospice, or preventive care. Other services that now cost 20% under Medicare would cost 10% under Healthcare America. The plan would also set annual limits on deductibles and co-insurance payments. Additionally, you would have coverage for prescription drugs and long-term care. Something as comprehensive as Healthcare America is complex and technical, but there is a simple human side to it. For Susan Hill and caregivers everywhere, Healthcare America would provide respite care for her and custodial care for her husband. For the Greens, Healthcare America would cut last year's drug bill from $3,400 a year to $340. And if and when Carrie needs long-term care, Healthcare America is the plan that Rudolph asked for. Healthcare America would be there for Mike Ozegovich and anyone who loses or changes a job. The John Sables of the country would never again be denied insurance because of a pre-existing health condition. And children, our greatest natural resource, would be given a fair chance to live productive and healthy lives. But Healthcare America is only a draft. AARP wants to hear from you. Meanwhile, we'll continue to evaluate other plans because we realize there may be several ways to achieve our principles of healthcare reform. For example, Healthcare America could be converted into a single-payer plan. Under this system, health care coverage would be provided through the federal government, thus greatly reducing the role of private insurers. Healthcare America, as a single-payer plan, would eliminate the private insurance option for employers. Public and private administrative costs would be lower. As a single-payer plan, Healthcare America would still use the Medicard and provide the same comprehensive benefits. Either as a blended plan or a single-payer system, AARP realizes that healthcare America will be controversial. But debate is fundamental to our democratic process. By providing this proposal, we hope to move the debate closer to a resolution. At stake is the health of America. Our country is at a crossroads, similar to the one where we were at almost 30 years ago, when millions of older Americans lived on the edge of poverty. Overwhelmed by the high cost of health care, many were forced to choose between basic health care, food, and housing. But Americans did not close their eyes to this tragedy. From the hardships of an aging population came Medicare, and it has served us well. Well, today we're faced with an even greater challenge: to heed our responsibilities as a proud country and build a stronger, more affordable health care system. A system that provides quality health and long-term care to everyone. A health care system that celebrates the American spirit and reaffirms us as a just and caring people. I'm Jim Hartz for the American Association of Retired Persons.